All right, folks, it's that time of year again. The Medicare Advantage AEP is October 15th to December 7th. So if you are a Medicare beneficiary or if you are helping a loved one navigate the world of Medicare, make sure to stay tuned to the end of this video. We're going to be talking about some of those very big 2026 changes and discuss the changes in premiums and, of course, how to select the best possible Medicare Advantage plan for your needs utilizing Medicare.gov. Now first, a quick refresher as to the basics of Medicare Advantage. Now if you're a pro, you can feel free to jump down below to the description where you will see some timestamps and jump ahead to the next section of the video. So Medicare Advantage is also known as Medicare Part C. It is an alternative to Original Medicare. It must offer at least the same benefits as Original Medicare, which is Part A and Part B, but very often it will offer additional benefits as well to entice beneficiaries. These would most often be things like dental, vision, hearing, and even prescription drugs. Many Medicare Advantage plans are offered at no additional cost. You simply need to continue to pay for your Medicare Part B. However, do not fall for the false advertisement that Medicare Advantage plans are free. At the very least, as I said, you still need to continue to pay your Part B monthly premium. Now, how do these plans offer these additional benefits at often no additional cost? Well, basically, the government and Medicare considers you to be a financial risk, and they are willing to pay these private carriers, which are the Medicare Advantage plans, to take on your financial risk. So the benefits that you're paying for are basically already being paid for by Medicare, just to the private carrier. Now, there are pros and cons of Medicare Advantage. Many Medicare Advantage plans offer those additional benefits, as I mentioned, and very often when you're comparing a Medicare Advantage plan to something like a Medigap plan, which is entirely different, it seems much less expensive. However, there are issues with Medicare Advantage plans as well. For example, you must operate within a network. Medicare Advantage plans are offered as HMOs or PPOs, as opposed to Original Medicare, which has no network. Now, of course, you will have much more flexibility with a PPO than with an HMO, but you will have nowhere near the flexibility as with Original Medicare. And the biggest issue of Medicare Advantage plans is that of pre-authorization. So even if your doctor has recommended that you receive a certain service or treatment, your plan must first approve it as well. This can lead to delays or possibly even denials. So we highly encourage you to stop and think before enrolling in a Medicare Advantage plan just because they offer fitness benefits. Now, that being said, Medicare Advantage plans can still be a great option for you. And in fact, over half of Medicare beneficiaries are actually enrolled in a Medicare Advantage plan. Additionally, if you live in someplace like Florida, Medicare Advantage does tend to reign supreme. And Medicare Advantage offers additional types of plans such as D-SNPs for those that are dually eligible for Medicare and Medicaid, and C-SNPs for those that have been diagnosed with certain chronic illnesses. So I highly encourage you to check out that as well. Now, this year has been a huge year for changes in Medicare that are set to take place in 2026. So what are some of these big changes? 2026 brings some of the largest updates to Medicare Advantage in years. The Centers for Medicare and Medicaid Services, CMS, is adjusting rules on how these plans operate, including network flexibility, cost sharing, and new incentives for managing care. Prescription drug pricing changes as part of the Inflation Reduction Act will also affect Medicare Advantage plans that include Part D coverage. Understanding these changes now can help you to avoid surprises and help you make the best decisions for your health and your wallet. So let's break down some of those key changes that you should really understand in 2026. Expanded benefits. Many Medicare Advantage plans will be offering additional benefits beyond the usual dental, vision, hearing, and prescription drugs. These can include things like transportation, or meals after hospital stays, or in-home health care. Pre-authorization and care management. Pre-authorization has always been a huge issue with Medicare Advantage, but CMS is really now enforcing more transparency in delays and denials and mandating that Medicare Advantage plans have to respond in a more timely fashion. Cost sharing adjustments. Now, Now, of course, the costs that you see regarding your deductibles or co-pays will shift based on where you live and the plan that you enroll in, but CMS is setting stricter regulations regarding out-of-pocket costs, which is great for beneficiaries who require more frequent care. Network flexibility. Many Medicare Advantage plans are now offering more flexibility and expanded networks or even telehealth services. Now let me stop here because it is not all sunshine and roses. You may notice that there are actually less Medicare Advantage plans available in this year, and that may be a trend that continues in the years to come. For example, Aetna is pulling out of many of its Medicare Advantage plans, and with less competition in the market, that could mean less of an incentive for other carriers to offer additional benefits. We'll see how this trend continues in the years to come. Now, the other problem with this unknown is Medicare Advantage versus Medicare Supplement plans. Now, truthfully, in our estimation, Medicare Supplement plans are really the way to go. They give you all of the flexibility and the benefits of original Medicare with that financial solution offering you a way to really cap your out-of-pocket spending. However, when we're really being realistic about it, Medicare supplement plans just may not be financially feasible because that additional monthly premium may not be something that you can afford, which is why so many people look to a Medicare Advantage plan instead. However, something that's very important to note: if at this time you choose to enroll in a Medicare Advantage plan because you believe it suits your needs now, or it's offering you a tremendous amount of benefits with a lower monthly premium, you may not be able to easily switch to a Medicare supplement plan further down the line. In most states, you are only guaranteed issue a Medicare supplement plan without medical underwriting in the first 6 months after you turn 65 and enroll in Part B. However, there is sort of a trial right period with Medicare Advantage, so if you're within that first year, you can more easily switch back to original Medicare and a Medicare supplement plan. Now, if you'd like to learn more about Medicare Advantage plans versus Medicare supplement plans, I've got a video that goes much more in depth, which I will link at the end of today's video. Of course, if you have questions, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's no charge for our services. So if you have questions or you would like assistance with the enrollment process, we are more than happy to help. And I do highly encourage you to work with a broker, regardless of who you choose, because with Medicare Advantage plans, the benefits and the costs can vary widely. So it's much easier to have someone who's in your court who can answer all of your questions and make sure that you're really enrolled in the best possible plan for your needs. And of course, please make sure to like this video so we can get this information out there, and subscribe to stay up to date. I cannot stress that enough. There have been so many changes with Medicare, and it's really important that you stay up to date for this very, very important part of your retirement. All right, let's get back to it. So here we are on Medicare.gov. Please bear in mind, during the recording of this video, we're still in the government shutdown, so things may change by the time you watch this video. So just scroll on down to where it says Find Health and Drug Plans. Now we are looking specifically for 2026. You are going to put in your zip code. Now we are looking at Medicare Advantage plans, also known as Part C. Of course, if you are opting for original Medicare instead of Medicare Advantage, then you might be looking for a Medigap policy to supplement that coverage, or Medicare Part D to add in prescription drug coverage, because original Medicare does not cover prescription drugs. But again, we're looking at Medicare Advantage. Now here is very important questions. Do you get help with your Medicare health or drug costs? So if you were to click Medicaid, you would be known as dually eligible and could look at DSNPs, which are dual eligibility special needs plans. You also would check if you receive supplemental security income, help with the Medicare savings program, or extra help with drug costs. For today's video, we're going to put I don't get help from any of these programs. Do you want to see drug costs when you compare plans? So not all Medicare Advantage plans offer prescription drug coverage, but if you are going the Medicare Advantage route, it is highly advisable that you choose a plan that does cover prescription drugs. So let's put yes, we want to see our drug costs when we compare plans. So let's put in some basic medications. I'm going to add this drug. That's a generic. I'm going to add this drug, which is almost never covered. Let's add that one, but we're going to keep the brand. And we will also add, this is another brand name, but it's more likely to be covered. So we'll keep the brand. There we go. All right. Done adding drugs. You're going to want to put in some pharmacies as well. It's going to automatically populate some pharmacies close to where you live based on your zip code. Now, I highly recommend that you compare a mail order pharmacy as well, because depending upon your plan, that could save you a significant amount of money. And let's pick some other pharmacies, a mix of chains and more local specific pharmacies. Did I pick CVS? No, let's pick CVS as well. And let's add a Walmart. That should give us a good range. Continue to view plans. So right now, it is filtering, or rather it's sorting by lowest drug plus premium cost. Now you will notice that there are many Medicare Advantage plans with a $0 monthly premium. However, it's very important to note that doesn't include the standard Part B monthly premium. So you need to continue to pay for your Part B monthly premium. Let's take a look at some of these plans. So this is the name of the plan. We're not technically in open enrollment yet when I'm recording this video, so you don't see the star rating, but that'll be out there soon. And if you scroll down, you will see the monthly premium, total drug and premium cost. We'll get more into that in a moment. It's likely because of that Lipitor. You will see the other costs, including the health deductible and drug deductible. Sometimes it's one and the same. Sometimes it is two separate deductibles. In this plan, it is two separate deductibles. So for this plan, that means that you do not need to spend anything out of pocket for your medical costs before your insurance begins to contribute to the cost share, meaning the copays or the coinsurance. However, for the prescriptions that you take, you first need to meet your drug deductible and spend $370 out of pocket before your insurance begins to contribute to the cost share of that medication. This is also a PPO plan, which means you will have coverage in and out of network. However, it's very important to note that should you choose to go in network, your copays and coinsurance will be much lower than out of network. Also, there is an in and out of network out-of-pocket maximum that you should be aware of. So your in and out of network out-of-pocket maximum is $6,900. If you choose to just stay in network, it is $5,400. That's for this specific plan. Over here on the right side are some more of the important details in this snapshot. So here are some of the most common benefits offered by Medicare Advantage plans. If it's got a check mark, it's covered. If it's got an X, it's not. So vision, dental, hearing, fitness, over-the-counter drugs, worldwide emergency, telehealth. Remember, Medicare Advantage plans are still offering telehealth, and home safety devices and modifications, all covered. Transportation, in-home support, personal emergency response system, and Part B premium reduction, not covered by this plan. Here's a brief snapshot of your copays and coinsurance. More details for that in just a minute. $0 for your PCP. $30 for a specialist, and drugs includes drug coverage. Now I'm going to scroll up here for a moment. You can filter here. So let's say it's very important to you that you have a PPO, and I would recommend that you do so. You would check PPO, and it's going to filter out all plans that are not PPOs. Let's say it's very, very important to you that your plan has dental. Well, then you would select dental, and it will filter out all plans that don't offer dental. Let's say your insurance carrier is very important to you, and that may be the case because Medicare Advantage plans can have, not always, but can have restrictive networks. If you know your doctor contracts with Aetna and Blue Cross and Humana and United, you might check those to make sure that you can still continue to see your doctor. If you want prescription drug coverage, and again, we've said we want prescription drug coverage, go ahead and click that one as well. I'm going to clear these filters just because I want to keep looking at everything, but I am going to put includes drug coverage. We will apply filters for that. So let's see, before we had 56 plans, now we're down to 43. So most plans do offer prescription drug coverage. It's pretty easy to find a plan that fits your needs that will offer prescription drug coverage. So this is the same plan that we were looking at before. Let's click Add to Compare. You can choose up to 3 plans to compare. Let's scroll down. This is great. I want to compare this with an HMO as well. Okay, and let's see. Is there anything else? I'm just scrolling down. Let's see if there's anything else that would be helpful for us to compare. Let's see. These all have drug deductibles as well. Ooh, that's a very high out-of-pocket maximum. Well, sure. Let's select that one as well. AARP. All right. Compare. All right, so here are the 3 plans that we chose to compare. So we're looking at the star rating. Oh, this plan is new, so no stars. But these plans already have a star rating from previous years. Health deductible, $0 across the board. Drug plan deductible. These plans also have some type of drug deductible, with this plan offering the lowest, $370, $605, $600. Out-of-pocket maximum. So because these 2 plans are PPOs, you will have an in-network out-of-pocket maximum and an out-of-pocket / in-network out-of-pocket maximum. For this plan, because it's an HMO, there is only an in-network out-of-pocket maximum. If you choose to go out-of-network for any reason, then you will be responsible for the full cost. Premium, these are all $0 premium plans. You do need to continue to pay for Part B. Drug premium, there's no additional charge. Part B monthly premium, like I said, you need to continue to pay for that. Oh, this does offer that reduction though. Yeah, that can be the case, but please don't choose a plan that is not going to cover your basic needs just because it offers this Part B reduction. So here are the plan features. These are those snapshots of some of the benefits offered by these plans. You can do a brief compare and contrast. I would caution you with regards to the dental plans that are very often offered by Medicare Advantage plans. In all honesty, the dental coverage may not be adequate for your needs. So you want to speak to your dentist about that, look into that more thoroughly, and you may need to consider that you may still need some type of supplemental dental insurance. Scroll on down. Here's the benefits and costs. This will break down that more specifically. So your PCP, in-network $0, out-network $5, HMO, so only in-network $0, $20. A specialist, these are the copays for your specialist. Diagnostic tests and procedures. Lab services. This one does have a co-insurance, which means it's more variable. Remember, copay is a set amount, like $20. Co-insurance is a variable amount, so it's a percentage, 20%. That can be a little bit trickier because 20% of what? Diagnostic services. Here are your copays. Outpatient x-rays, emergency care, urgent care, inpatient hospital coverage. This is broken down by length of stay. So for this one, days 1 through 6, it's $325 per day. For days 7 through 90, $0. For this one, it's $440 for days 1 through 4. After that, it's $0 for days 5 through 90. For this one, $550 for days 1 through 5, $0 for days 6 through 90. Continuing to scroll, outpatient hospital coverage, preventative services, those are usually going to have a $0 copay. Here's some of those extra benefits. This prescription hearing aids in-network $399 to $699. That's a great benefit because hearing aids can be rather expensive, although as of late, there have been over-the-counter hearing aids available, which are much, much less expensive. Here's some of your dental insurance. So $0 for oral exams, that's usually the case. X-rays, cleaning, comprehensive dental, here's where things get more expensive. Restorative services, 0 to 50%. Periodontics. It doesn't say what your maximum is here. You would need to do some further digging, especially with the dental, because you want to find out what your plan limit is. If it's a very low limit, then it may not help you much at all. Here's some more benefits. Eyeglasses, skilled nursing facility. Let's scroll down to the drugs because that's pretty important. All right. So I put in a drug that is almost never covered, and I'm willing to bet that's why some of these costs are so expensive. Yep, here it is. So 2 of the 3 prescription drugs that I put in are covered by all of these plans. It is most likely the Lipitor that is not covered, which is why we are seeing such high costs here. Let me see. All right, I want to look more closely at this plan. So we're going to look at the plan details. Here we go. Some of this information we've already covered. So I'm just going to scroll down to some of the stuff that it'll go more into specific detail on this page. If you want to look at more benefits and costs, mental health services. Here we go. So here's our prescription drug costs. And here really is most of the expense. It's actually all of the expense. It's Lipitor because it looks like the other two medications, even though this one is a brand name, there's actually no copay for it. That's great. It's really this Lipitor that is causing us the problem. So honestly, for the purposes of this video, you can ignore this. It's just good to know that there are some medications that are just, it's very difficult to get them covered by any plan. Now, if that's the case, if you're someone who absolutely needs to take a brand name medication that is not covered by your plan, then you should look into other cost-saving alternatives like GoodRx, like state pharmaceutical assistance programs, etc., to get some type of discount if you absolutely cannot take a generic. Let's see, anything else important that we want to look at here? Well, these are the drug costs. View more drug coverage. This is very important. Okay, so this plan has 5-tier. All right. So with the recent changes to Part D, which does affect Medicare Advantage as well, there is no more donut hole, and catastrophic coverage is really now just an out-of-pocket maximum. So you need to meet your deductible. You're in that initial coverage phase. And if you continue to spend those covered in-network medications, so the medications that are on your plan's formulary, would count towards getting you closer to catastrophic coverage. But here are the copays and coinsurances for the medications based on the tier of the medication in that initial coverage phase. So after you've met your deductible. So it's $0 for a preferred generic, $0 for any type of generic, a 19% coinsurance for a preferred brand, 25% for a non-preferred drug, and 28% for a specialty tier. These medications are considered Tier 1 and Tier 2. The Lipitor is not covered at all, which is why we see those very, very high costs. Here are your Part B medications. These are the only medications really that are covered by original Medicare. Mostly those are medications that are administered in a doctor's office, vaccinations, certain insulin if it's administered via pump, chemotherapy, other oral anti-cancer drugs, etc. Here's some more information about your dental. Now let's see, I want to look over here and see where it says limits apply. You'll see this on basically everything. Oh, we can't find out. Let's see, can we find out what the plan limit is here? Plan limits. There may be limits on how much the plan will provide. I'm not seeing here what the limit of your maximum is for your dental. So another reason to work with a broker, because sometimes it's very difficult to find this information on Medicare.gov, and you may need to call the plan directly if you have further questions. And here are some more benefits that may or may not be covered. Continue to scroll down. Telehealth still offered by Medicare Advantage. I can't stress how incredibly convenient that is, and it's a shame that original Medicare is sort of phasing it out. These are some additional benefits that are sometimes covered but not covered by this plan. Now, something that it's not showing here, plan limits. There may be limits like the number of times you can use the item or service or how much the plan will cover. Contact the plan for details. Like I said, sometimes you need to contact them directly to get more information. What it's not really specifying here, but what these plan limits indicate also is that issue of pre-authorization. You will see that indication on really on every Medicare Advantage plan because it always applies. So what do you think? Do you think Medicare Advantage is trending up or trending down? Are you seeing good changes or bad changes? Let us know in the comments below. Of course, if you have any questions, you can reach us there or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there is absolutely no charge for our services. And please, before you go, make sure to like and subscribe to stay up to date. Thank you so much for watching, and we'll see you next time. Bye-bye.